This is Pet Life Radio. Let's talk pets.
This episode of Vet Candy is brought to you by behaviorist.com, featuring podcasts and blog posts along with advice from a top veterinary behavior expert.
Welcome to Vet Candy's podcast and other news, a podcast to expand your idea of what is impacting the veterinary world, veterinarians, and all animal care professionals as humans. We are your co-hosts. I'm Dr. Jen.
And I'm Dr. Jason Chatfield.
If you are not yet a Vet Candy subscriber,
why not?
Please subscribe for free today at myvetcandy.com. And you can reach us, rather me, with all messages of love and positivity at Jen at myvetcandy.com.
And as always, for the reals, you can get down with me at Jason at myvetcandy.com.
Okay, so our topic today is behavior.
In other news, veterinarians have behavior problems.
I may
have said that wrong. But I mean, it's true. Veterinarians, there are some veterinarians, we all know them, that do absolutely have behavior problems, but I think we're focused on the animals today.
Yes,
correct?
Yes.
Am I correct? Okay.
That's right. We're not worried about any social incompetence that may exist among professionals. That
doesn't exist. No, I've never even noticed that before. Every professional I've met is very competent socially.
I know, right? So anyway, we're talking about behaviorals. So Jason, I got to tell you that when I was doing relief practice and when I had the emergency clinics, I did not get excited when somebody came in asking for help with a behavior issue because most of the time I wasn't quite sure what to do.
You didn't get excited? You maybe just got nervous? No? You didn't know what to do? You didn't have all the tools in the tool belt?
Yeah, it may have manifested as a behavior issue of my own.
There
yes,
you go.
in fact,
I
it might
probably
have.
Did.
I know, but luckily today, as always, we're going to welcome an expert into the Candyverse, right?
That's what we do. This is how we roll. We bring up a problem and say, here, you solve it. It's perfect.
That's right. It's one of the luxuries of being a podcast host on In Other News.
Exactly right.
That's right. So let's bring our host in quickly before we have to talk too much more about behavior issues. So we want to welcome into the Candyverse today Dr. Terry Curtis, behaviorist, veterinary behaviorist extraordinaire. But really, she's a board-certified behaviorist who's had, I don't want to say too many years. How many years? 20 years? 20 years working with behavior. In fact, Jason, she only works on behavior issues.
Oh, my gosh.
Pets. I know.
That's a big tool belt because behavior issues are, listen, let's be honest, very difficult. Very difficult.
Yes. What do you say when we say something like that, Dr. Curtis? What are you saying?
It is. It's very difficult.
It is.
That's right. You better say that. You've been doing it for 20 years, right?
Yep. It's very difficult. Actually, it's not difficult, but let's try to make it as easy as possible.
Oh, you're now all the news hounds instantly love you for saying that. Everybody that's listening. And so today we actually want to focus, Dr. Terry, on something that I think a lot of pet owners worry about or maybe think they're dealing with at different times. At least I would hear a lot about it when I was in practice. You know, we can talk about all kinds of behavior issues, but I think we want to talk a little bit about separation anxiety today.
Okay.
Start with that, right? And then we'll get to like your favorite ones a little bit later.
Okay.
You say that like you didn't believe it exists. Didn't you say that, Terry? Like it didn't really exist. Like she's like, maybe it's not a thing, right? It's a thing. It's got to be a thing.
Separation anxiety?
Yeah.
It's a
let's
thing.
gang up on Jen. Right?
It's a thing.
Yeah.
It's a thing.
Separation anxiety is absolutely a thing.
Okay. It's a real thing. So it's such a broad topic, isn't it?
It can be. So we can start by thinking about what's going on with let's keep it with dogs. I mean, cats can get separation anxiety as well, but I think.
Wait a minute. Cats? Are you kidding me right now?
Nope. Can get separation anxiety, but it manifests in a different, less problematic way, typically for owners. Cat separation, I'll just do a quick sentence. Separation anxiety in cats typically manifests as over-grooming. So cats get bald when they're anxious away. Or they pee outside. Hey, if you're going to mock what I do.
No, dude. We're not mocking it. I'm just thinking, like, how do I diagnose that in a Sphinx cat?
I'm just thinking of a bald cat. That's really a problem.
See? This is why cats are under the radar so much of the time. It's really not that much of a problem.
Right.
And cat, you're right. Who's going to know? So maybe a Sphinx cat, they're going to be peeing outside the litter box. But anyway, talk about dogs.
Yes. So how come, like, before we go to dogs, because honestly, I must share with you, I know this will not shock Dr. Terry. I really didn't know that cats could suffer from separation anxiety. That's like a pearl. Already today, we're 5 minutes into a podcast and there's a pearl. Cats with separation anxiety.
As with pain, I think one has to realize that every being can experience anxiety to one degree or another. And so cats can experience anxiety, manifests a little differently, not the cat whose owner leaves for work every day, but more the cat whose owner is packing to go on a trip. Get anxious when it sees the luggage and gets all freaked out and starts to, again, overgroom or spray or not use the litter box. So it manifests its anxiety in that way.
Yeah.
Dog is going to manifest it in more destructive behaviors, disruptive behaviors, howling, barking, peeing, again, pooping. So it's panic. It's all panic behaviors, whether it's a dog or a cat.
And how common is separation anxiety? First, I'm going to ask in cats, and then I guess what I should say is how common is separation anxiety recognized by an owner in a cat versus in a dog?
That's a good question. And it's going to be difficult to answer because I'm only going to be brought in when an owner has recognized it and B, determines that it's a problem. And so if they're not really concerned about their bald cat, then I'm not going to hear about it. The primary veterinarian may hear about it, but it's not something that's going to necessarily raise a red flag for the owner because it's just not that big of a deal.
Yeah, that's interesting. That's a whole nother reason to bring your cat to the vet because, we only see 20% of cats roughly anyway at the veterinarian, let alone those who are maybe experiencing a little bit of or a lot of stress and anxiety. They're not coming out.
Nope.
Yeah.
Dr. Jen, champion of the cats.
Boom.
Speaks again.
Right I'm going to add that line to my CV.
All right, separation anxiety. We can focus on dogs and cats. I'm sure they're treated different, but dogs are the majority of what everyone sees, let's be honest. Okay, so we should probably focus on that. So we've all heard the client. My dog is, the pooping in the house is just an awful situation, right? Nobody wants that. But mainly, what's the main symptom you see with a dog?
Yeah.
Okay, so we have to back up a little bit because often the primary veterinarian is going to have contact with the owner where the owner calls them on the phone or comes in and says, my dog has separation anxiety. So they typically come into the veterinarian with a diagnosis. That diagnosis may be correct. It may be completely incorrect.
Great point.
Who's made that diagnosis, Terry? Dr. Curtis,
the owner.
Did you make it?
The owner has made the diagnosis.
Yeah. I love it when they bring a pet here. My pet has a problem. Here it is. Fix it. This is great.
This is it. Here it is. So,
but in fairness, sometimes they're right.
Sometimes they're right, but regardless, the veterinarian has to kind of take over and start asking a few pertinent questions to really get at what is going on.
Okay. Since
typically the behavior is occurring when the owner's not there, the owner is going to come home to certain behaviors that have happened while the owner's away. We need to know what those behaviors are. When do they occur? Do they occur every time the owner leaves? Do they occur only on Tuesdays? What's going on Tuesdays? Why isn't the dog exhibiting these behaviors on any other day of the week? How bad are the behaviors? Is it truly just going after the trash can because it's investigating something? Truly digging up carpet at the exit door? So we really need an explanation or a description rather of what the behavior is.
This sounds like really like I have to get a whole picture. Like I need to see like a day in the life of that dog or maybe 7 days in the life of that dog, right? Like you really have to see everything that's in his environment.
Well, right. And get some idea again of when it's happening. So if the owner can be gone for an hour and the dog is okay, but the dog can't be okay if it's left alone for 10 hours. Are we dealing with separation anxiety or are we dealing with house training? Are we dealing with, I just go? If the dog is howling because there's a storm or there's another dog outside, that's not separation anxiety.
Right.
So getting an idea of getting from the owner information about what's happening, when is it happening, inside the house, where is it happening. Typically, dogs are going to show panic at exit points. So windows where they can see owners leave, doors where the owner has left. But then it gets even a little more complicated because there are some dogs that have just departure anxiety. So if they see their owner leave, they start to freak out. And that's the biggest problem for them. If departure is masked, if they're in another room, chewing on a bone, going at a food puzzle toy, and they don't see their owner leave, and they find themselves alone, for those dogs with departure anxiety, they're fine.
They just go like, I guess they left.
Yeah,
oh, well, this bone is good.
That really, by the way, that works great with children also. You can just sneak out the door and shut it, and it's like a whole thing, right? I mean, I'm just kidding. I'm just kidding. Don't send the people after me, okay? I would never do that.
Right. So everyone should know, right? Like, I just want to let everyone in the Candyverse know. Dr. Terry gives these incredible lectures, like continuing education lectures for veterinarians, and she talks about these behavior issues. And I've never seen somebody with so many videos in their lectures, and here's why. Because everyone's petrified the video won't work, right? But anyway, they work. And I remember you showed one, and you were talking about separation anxiety, I think is what it was. And you were saying, what is separation anxiety and what it's not. And you had owners put a camera in the house, and then they left. And so they saw what their dog was doing. And you could just kind of watch this dog like ratchet up the freak out.
Right.
You know, that was my technical term. And it it finished after, like, it went to the door and it was pawing at the blinds and all this and racing room to room. And then all of a sudden it was defecating right there by the front door. Right. You know, it just, and then the owners came back. And then of course there's this whole scene when the owners get back, right? Because the dog pooped in the house, it messed up the door, it did whatever. And it's just so glad I think its owners came back. But it was incredible. And you said that was like the most eye-opening thing you do for clients is put a camera, like, so they can see what their dog is doing.
So it's important, and I'm not a sadist. I don't want people to feel badly watching animals in the test. It's really hard.
I mean, not too badly. You want to feel a little bad, right?
A little bad.
I want them to feel bad.
Know what's going on? Just don't want to crush their spirit.
No, exactly. I need them to understand that this is panic, not spite.
Yeah.
Sitting in a corner with a cigar and a martini, ruination of the universe. They're panicked.
Right.
And the video is the best way to see that. So give you an idea of when the dog is doing what it's doing, what the dog is doing, how long the dog does it. Since, again, the behavior is happening when the owner's not there, that's really a huge part of the diagnostics. To see what's going on when the owner's gone. So again, you have departure anxiety. You can have that as a discrete issue. You can have separation anxiety, where the dog truly cannot be alone. You have confinement anxiety, where the dog just can't be crated. And there are a huge number of dogs that are in this last category that have been crated since puppyhood for maybe an infraction of chewing or house trained. And they're somewhat okay in the crate, but not really. And then at this point, maybe around 1-2 years old, where they really start to bust out of the crate. And so they're all being tagged with this quote unquote diagnosis of separation anxiety. So they're thrown back into the crate. And it really isn't the fact that they can't be left alone. It's that they can't be crated. And so these dogs, one of the first things you have to do is just get them out of the crate.
Oh my gosh, because if that's like misdiagnosed or mischaracterized, then all of a sudden I take the dog who's petrified or his panicked brain, right, when he gets put in the crate, and I just shove him further into a crate. I mean, that's like 100% opposite what we want to do for that guy.
Right. Well, I mean, let's get into, we can do a segue or sideways bar on crate training. It's like, dogs in crates.
Yeah, we can do that. But
First of all, I don't know what a sideways bar is, but that's really interesting.
Well, it's something off to the
sidebar.
I get it.
Sidebar, something not down the main path.
I gotcha.
Call it
rabbit trail.
Call it what we will, but
I think I would call it down the rabbit hole, because this stuff is really interesting, right? You just put down the rabbit, you're going to go really far before you come back to find out what's going on. I don't know how you seriously deal with this kind of stuff, because a lot of it's owners, a A lot of it's dogs, a lot of it's owners and owners and owners. And I think it's very difficult for you to do that. But anyways, Jennifer, you were going to say something. So sorry.
Well, I was just going to say that. So now that we've like kind of illuminated our world related to the different kind of triggers for this anxiety, whether it's, I don't want to say separation anxiety anymore because I don't think that's accurate, right? I want to say
it's pigeonholing too much, right?
Yeah, the anxiety, whether it's related to separation, departure, confinement, or loud noise or whatever is causing the anxiety for that creature. So this is a yes or no question, Dr. Curtis. Yes or no? Ready? Yes or no?
Okay.
Is there anything that we can do? Yes or no?
Yes.
Okay. Yes. So yes. I know, right? On the other side of the break, everyone has to hang with us. On the other side of the break, we're going to get into solutions because already I'm feeling like there's all these dogs out there. There's crazy anxiety that I want to I don't want them being so anxious because I feel that's scared. I mean, that's what we're saying anxious, but they're petrified. And so, yeah, let's fix that. Okay. So on the other side of the break, hang with us. We're going to get to some solutions.
Is your pup a perfect little angel all the time? Does he ever bark or howl, chew up your shoes, or worse? Our little angels may not be on their very best behavior 24/7, but we love them anyway. Behaviorist.com is here to help, featuring podcasts and blog posts along with advice from a top veterinary behavior expert that will help make your dog a much better roommate. You and your carpet will be very happy you did. That's behaviorist.com.
Oh, sure. It's all fun and games until someone ends up in a cone. That's right. We're animals. Deal with it. Pet Life Radio. Let's talk pets.
All right. And we're back, but we're not anxious. Or are we? I'm not sure. Either way, we're back with Dr. Terry Curtis discussing that there's different kinds of anxiety that any of our pets might feel. It turns out cats get anxious too. So we talked about the 3 different major kind of commonly seen types of anxiety that people classify all the same when they're not, right? The departure anxiety, true separation anxiety, and confinement anxiety with the crate. And so she promised us that there was something we could do. So we kept her in the Candyverse, don't worry. And so Dr. Curtis is going to share that with us. But first I want to share a pearl that I think relates to this that I picked up several years ago at one of her lectures, which if you have an opportunity, you guys should roll out and hear the lecture. The panicked brain cannot learn, right?
No.
Yeah, right? It's incredible.
They should start physiology, 101 with that. Okay, so no one panics about that kind of stuff. It's hard to learn physiology in vet school because you're panicked all the time.
I mean, I'm thinking right now, Jason, you must have panicked all the way through anatomy.
I should never have learned a thing, right? Anatomy. What's that? I don't think I learned any of that, right?
Right, exactly. Okay. I mean, we're joking, but this is a very serious thing because a lot of people, they consider giving up their pet because they can't address the manifestation of that anxiety, right?
Right.
Yeah. So what are we going to do? What am I going to do?
Can we take a step backward for just a minute?
Yes.
And talk about anxiety in general?
Yeah.
So whether you're and you talked about this a little bit, helping pets, helping humans. If I can't, or a primary veterinarian can't explain things to a human, there's no way we're going to help the pet. Okay. So the human really has to understand what's going on with their animal. And so I think first and foremost, kind of getting into their skin and having them understand that they really are any client of mine and any client that has a pet with a behavior issue is really in the situation of having a pet that they didn't sign on for. No one wants a cat that's peeing all over the house. No one wants a dog that's trying to kill a neighbor. No one wants a dog that's chewing through drywall because it's in absolute panic because they're left alone or there's a storm. And so not only do you have the issue that you have to deal with the pet, but you also have to deal with the owner, who really is between a rock and a hard place, because what are you going to do? Euthanize a dog or a cat because of a panic disorder? That's some really hard stuff.
That's hard. That's heavy.
It is heavy. And so I think by making things as simple as possible for the owner to understand, it goes to being able to treat it and to make things better.
Yeah.
So I think, first of all, when you think about anxiety, whether you're a dog, cat, rat, or human being, it basically comes from two places.
Yeah.
It comes from knowledge of something bad happening. So you've been in this situation before, it didn't go well, you're back in this situation, it's not going to go well. So you're fearful of being where you've been before, where it hasn't been good. So that's one type of anxiety. The other type of anxiety is, I don't know what's going to happen. So you have uncertainty. So when you're looking to treat anxiety, the goal has got to be to make things not uncertain, okay, so things predictable, and you make it so that it's incompatible, the situation is incompatible with the first one, and that's something that's bad. And so the goal with treating any anxiety, again, dog, cat, rat, human being, it has to be, what is going to happen? This situation that I'm now going to work on creating has got to be consistently good.
Okay. I agree with that. And I think every veterinarian who's been through vet school and taken a board exam, a licensing exam, can feel that, right? Because we see that manifest a lot of times. If you take a licensing exam for any profession, if you don't pass the first time,
pretty hard the second time.
It's really hard the second time. And it's the same thing if you're taking a class, a course, and you fail and you have to retake it. It's even harder to do well the second time because you're already manifesting like that anxiety about it already went badly and now I have to do it again. So yeah, right. Interesting.
Right.
So how do we do that with dogs? I mean, keep having positive interactions and positive results, but that's a difficult thing, I think, right? Starts to be
Not really. I think by simplifying it and not making it overwhelmingly complicated, that it's actually pretty easy to do. So,
yeah. All right.
Yeah, you ready?
Well, good.
You ready to talk about separation anxiety and how to make it easy?
I mean, who's not? But I don't want people to gloss over the fact that a lot of times by the time an owner comes to a veterinarian to ask for help for this, it's because the dog maybe has destroyed something.
Yep.
Or routinely is behaving inappropriately, and they finally get to the veterinarian and their owners are like, today we have to fix it today.
Well, or worse, the veterinarian has to talk them off the cliff, right? They've already come in with, they're already going to do the deed, right?
Yeah,
and you have to talk them back. And so this has been great. We have all kinds of tools. You can say, no, listen, no, it's not hard. It's easy. Here's what we're going to do. Bam, bam, bam. And Dr. Terry in a few minutes is going to give us the bam, bam, bam. All right, I think that's what's going to happen.
Not the wham bam, but the bam, bam, bam.
Myself, yeah, bam, 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 and take some notes. All right, because that's what happens. I don't know where you guys are, but that's what happens. I am tired. I'm tired of my dog chewing through walls, costing me $800 a week. I'm done. Take care of it, and it's terrible. But I think people deal with that on a daily basis, right?
And so you have to be like a social worker too, because you have to deal with the resentment that the owner has built up against the dog, right?
Yeah, which is really resentment about themselves, but let's go on beyond that.
Yeah. Okay. So we know it's not simple. You've already told us it's complicated, and you made fun of us for saying it's simple. But so what are we going to do? What's the
okay? So let's take this scenario that Jason just put out there. The owners. Geez,
there's going to be no talking to him now, Terry.
Oh, Christ! Really? Okay.
Too late.
So number one, don't wait. Medicate. So if the owner
love it.
If the owner is looking to euthanize their dog, or they really have hit the wall as far as I can't do this anymore, the dog has to be medicated. We're going to get to the real crux of how to treat it as far as behavior modification, understanding that this is a learned behavior. Okay. So again, don't mean to talk in kind of a multi-pronged way, but it really is a multi-pronged thing.
Yeah.
Everything the dog has learned, all of those pre-departure things, picking up keys, putting on shoes, all the things that make the dog come unglued, now knows that you're leaving. It's all classical conditioning stuff. And so at some point, all of those classically conditioned, all of those conditioned responses need to be unlearned and classically conditioned in another way.
Okay.
You said, however, Dr. Jen, is that you can't learn if you're freaking out. So we have to address the brain chemistry, and we have to calm it down. We have to get the dog calm enough so that it can start to process the fact that it really is okay when it's left alone. It really is okay when it watches the owner walk out of the room. Mm-hmm. It really is okay. And so going back to anxiety, whether it's you or whether it's a dog, you need enough data to actually say, I'm okay. And so that has to be done enough times so that the dog really learns that, okay, I'm okay. I'm feeling fine. The owner leaves, comes back, everything's good. So medication to start that's going to work quickly. It's going to work fast. It's going to work for a short period of time for the duration for a departure.
Yep.
So
there's an issue with medication though, right? Like not all meds are created equal when we're talking about behavior issues.
Correct.
Okay.
So what do you want to know about meds? How much do you want to know?
I mean, here's what I want to know. If I am a general practitioner and someone comes into me and they say, look, I love this little dog, but I hate him. And he's either staying with you today or he's going to go have supper with Jesus. But either way, he can't come back to my house. So
the first thing you're going to reach for is a benzodiazepine. And so understand that the benzodiazepines, so diazepam, alprazolam, lorazepam, okay, all of those have different, clonazepam, they all have different onsets of action and they have duration of action that's different. Your fastest acting, shortest acting one is alprazolam. If you really want a dog to settle and maybe sleep for a little bit, then maybe diazepam might be better. It's going to take a little longer to work, but it's going to last for a longer period of time.
Okay.
So
that's a lot of choices, but that's good stuff to start. Like instantly now we can calm down and start to discuss what's really going on. Right.
Right. So you need something so that they now. We're going to talk about medication, but there's other things that you can do as a quick Band-Aid as well. But a medication that's going to work right away that doesn't take days to reach effect is going to be benzodiazepine, trazodone. Trazodone works in a different way. Benzodiazepines work on GABA. Trazodone works on GABA as well, but it also works on other neurotransmitters. So you're getting a kind of a synergistic effect by using the. And then there's also medications that you can start the dog on that are going to take weeks to reach peak effects that work at decreasing anxiety overall. So you have medications that address panic. Those are going to be your benzodiazepines and trazodone. And then you've got medications, the SSRIs, the selective serotonin reuptake inhibitors, the tricyclic antidepressants that work at decreasing the overall level of anxiety, which is, again, our long-term goal.
Right.
But Fluffy to be okay that he's not going to go meet Jesus this afternoon, it's got to be a benzodiazepine.
It's got to be a benzodiazepine. And, does that make me like a bad owner if I'm medicating my dog like that?
Would you hold an antibiotic if your dog had an infection?
No, absolutely not.
So
I've never dropped the mic on you. That's a good response.
Oh, did you hear that? She just said
some good stuff.
Yeah, let me put this in some context for you.
Right.
Yeah, but that's interesting. Because I think a lot of owners probably just like we have all these social issues surrounding medication and human mental health issues, there are owners who I think sometimes transfer that hiccup to their dogs. And so they feel like maybe they failed as an owner, if they're medicating.
Right. And I think there's definitely that group of owners, and I'm certainly willing and have to be able to talk about the benefits of these medications.
Oh, yeah.
Side of that is also there are owners that are like, I got that stuff in my medicine cabinet. Can I give Fluffy my...
Ooh.
I got some other stuff in my medicine cabinet. Can I give that?
Exactly. So there are some that absolutely understand panic disorders and generalized anxiety, and they absolutely want their dog to be feeling better.
Yeah. Yeah. But I think that's the other thing as a veterinarian, it doesn't mean that I think medicating for behavioral issues like that so that the client and the pet can have time to adjust to what could be a new normal, because the anxiety didn't ratchet up to 10 overnight either. I think giving them that time, that doesn't make you a failure as a veterinarian either.
No.
And unfortunately, I think we have some professionals out there who won't reach for drugs right away with behavior issues.
Who won't?
Yeah. because of that.
That's probably one of my biggest frustrations. When I get a call from an owner who's been referred to me by a general practitioner, and their dog is in what sounds like and appears to be abject panic, and nothing has been done, it's really frustrating because there are things that can be done.
So I'm going to ask you a question. This is like, it's not, well, it's one of my favorite questions to ask professionals too, but I already know your answer to this is why I'm asking it. So what about acepromazine?
That was my question. I already wrote it down. Doc, I want to give some ACE. Just give me some more ACE, Doc.
Give me some more ACE. Yeah. What's the difference between ACE and the alprazolam that you're talking about?
Acepromazine is not an anxiolytic. It is what is it, Jen? It is
I don't know, but I know what it does. It makes the brain still panic. The brain still panic, right, but they can't move to manifest the panic.
So if you think about treatment as a cocktail, so let's say you're making a martini. And so
boom, right in Dr. Jen's world, right there.
Jen's all ready for this. She's gonna
tell us how to are we doing gin or are we doing vodka martini?
Vodka.
Okay, so the vodka is going to be something like an SSRI, something like fluoxetine.
Okay.
The vermouth is going to be the benzodiazepine.
Okay.
Olive, for a very destructive and panicky dog, could be 1/10 of the sedative dose of ACE.
1/10.
You're addressing the panic, you're addressing the anxiety, but you're kind of just making this dog settle. Okay.
Yeah.
Those are for dogs that are going to tear the house apart. Now, going back to other options, there is boarding. They can board at your facility. There's doggy daycare. There's all kinds of things. And I think talking about options to clients is really important, instead of just saying, we're not going to be able to solve it in 2 days, because you're not going to be able to solve it in 2 days.
Yeah.
This is going to be a process, and just, giving people alternatives and options is really important.
Yeah.
And I don't know if you're going to ask this at some point, but I think people mentioned owners feeling badly.
Yeah.
Many think that it's their fault that their dog has separation anxiety. They've looked, studies have shown that really attached dogs are no more likely to have separation anxiety than those that seem to be a little more independent. So this idea of a Velcro dog, or taking your dog everywhere, or being home with your dog all the time, that's going to cause them to have separation anxiety. The data has not borne that out. The only thing that predicts separation anxiety in a dog is getting it from a rescue. And there you're looking at which has come first, the chicken or the egg. Is the dog in rescue because it had separation anxiety and was dropped off because it's not going to have it? Or does the dog have separation anxiety because it's, been in rescue after rescue after rescue? So we don't know. It seems to be the only thing that points to the possibility.
That's an interesting discussion. I didn't know that rescue dogs tend to have a higher incidence of this anxiety syndrome. But it's a great point. Who knows why, right? So
so you're missing everything. When you get a rescue dog, you have nothing. You don't know anything about their history. You don't know anything about their socialization process. You don't know if they were. Everybody thinks that their dog is abused. Probably not, but a big question mark, and it's a big unknown. And so you basically have this blank sheet of paper that, okay, what you have is behavior problem X. Let's solve it.
Mm-hmm. Yeah, I think that's interesting. It doesn't mean that people should necessarily look askance at a rescue, but I do think, just like with any other animal that you're going to purchase, I think understanding the history, which means just recognizing that could be something that comes along with the dog, and don't wait to get help from your veterinarian if you face that.
Right.
I think that's the key takeaway there, is that, we don't know what sort of trauma the dog has been through, physical or emotional or mental.
No, I think there's a lot of expectations, the humans, and I totally get the human end of it. Okay, we're going to go down to the pound and get a dog, and we're going to bring him home, and everything's going to be great. And the dog's like, I got nothing with you people. I don't have a bond. I don't trust you.
Yeah.
Nothing.
Is that a cat over there? I hate cats.
Exactly.
Who said I was okay with a cat?
So,
yeah.
All right. Don't wait. Medicate. My favorite line of the week here. So, so we talked about drugs, but listen, there's more, right? There's more. It's not. I know we could talk for hours on this stuff, right?
Yes,
it's not just throw drugs at it and solve it. I mean,
we're not going to throw drugs and just drugs. There's pheromone
save the dog
therapy.
Today. Yeah.
There's pheromone therapy. There's anti-anxiety supplements that are out there that can be useful. But the crux of the treatment has to come from the behavior modification, and that working on the departure cues, making.
So do you mean behavior modification of the dog or of the owner? Because I'm thinking the owner.
Well, no, behavior modification. It's for the dog. So going through mock departures. So let's say the dog starts to show anxiety. One of the questions that a veterinarian should ask an owner is, when does your dog start to show anxiety? And most owners absolutely know when. So it's when I start to put on shoes. It's when I take a shower. It's when I a cup of coffee, whatever it is. And so that person has to literally or figuratively make a list of all those things. And you have 3 options as far as what to do with those things on that list. 1, you can make them go away. So instead of having coffee that you're brewing in the morning, it's brewed at night and it's in a thermos, or you brew it at work or whatever. You put on. I once had a client who could not leave the house in a suit because his dog was completely panicked, but he could leave the house in running clothes. And his dog must have thought that he was just running all day,
Listen,
and had no problem with that.
That is unbelievable. How long did it take you to figure that out? I mean, that's such a you probably did it really quick. It would take me a year. I'm sure you did it in 2 minutes, but
no, he
clothes you wear.
He just figured it out. He's like, if I go for a run, the dog is completely fine. So what he would do is leave the house in the morning with his running clothes on, and he'd change for work at work.
Oh my gosh.
You do what you have to do. So you figure out what these triggers are for the dog. You make them go away. You do them at different times. You drop them from your repertoire or whatever.
Yeah.
You can habituate the dog to them, which is basically running through the trigger over and over and over, but never leaving, picking up keys, sitting down, picking up keys, walking to another room, picking up keys.
Picking up the nail trimmers,
Yeah. Or you can do classical conditioning, and that is pick up keys, give them a treat, put on shoes, give them a treat. So again, if you think about anxiety, it's either coming from something predictably bad or something unpredictable.
Yeah.
So we have to make what's causing anxiety predictably good. So we always come back around to our ultimate goal and have the dog to learn that if you think about anxiety, what you have to have is data that shows I'm okay. And so the dog has to have enough data points where he really does understand in his bones that, okay, owner left, but I'm cool, I'm relaxed, I got a little bit of benzodiazepine on board, I got a little pheromone stuff going, I got treats, they always come home. This is good.
Why do I care? They're gone. Great.
I don't care.
Treats for me. Good. Yeah. And so what I think is also key for owners to recognize too is that phrase that you use, and the reason it resonated so well with me, like, I don't know, maybe 8 or 10 years ago, is the panicked brain can't learn, which means every time you leave and their head doesn't explode, the boogeyman doesn't come out, doesn't mean that they're learning that, oh, it's going to be okay. Because they're not, because they're freaked out. So every time you leave, they think, oh my God, I skated through. The next time for sure he's going to get me. I'm anthropomorphic.
Right.
Yeah, anthropomorphizing.
Yeah.
That's it, right? And so I think once owners recognize, oh, well, no wonder. So continuing to do this is just like making this worse.
I laugh so much because that's exactly what I thought after every test in bed. Oh my gosh, I skated through, but the next one is going to get me for
that's
sure.
Right.
No, but it's true. We can all relate to that, right? So
yeah, but for me, that was such a light bulb moment. And I think for so many professionals, when we're faced in a busy day in the practice where we're looking at stuff like, dog with diarrhea, puking dog, diabetic dog, cat, who knows what the cat has. And then someone walks in and they're there to euthanize their dog because it's eating the sheetrock or it's pooping in the house or, whatever. This is not a 5-minute conversation.
No.
And this is something that owners really have to wrap their brain around because they really have to be engaged in the solution. It's not just medicate the dog. The owners have to be engaged in the solution.
But I think that it's also fair for veterinarians to take the time. You wouldn't say, I noticed that you have your dog has some dental pathology. I'm going to drop everything in my schedule and we're going to take care of it right now.
Yeah.
You wouldn't do that for that. Why would you do that for behavior? So take the time to say, this is really important. Yes, start bringing your dog in for doggy daycare, but let's make an appointment to talk about what we need to do going forward for this particular issue in your dog.
Yeah.
You care enough and show that there is actually something that can be done, that the owner will respond just like they would with any other recommendation that you make about their health.
Yeah. So I have a question. It's my normal question when we have very smart
He gets
people
one.
like you. That's my normal question. When should I consider referring this dog? When should I give it to somebody else?
Jason's thinking 10 minutes into that first appointment.
Well, it's
when am I over my head?
It's a very interesting question because I just emailed Jen about, would you read the manuscript of this book that I'm supposed to write? And this whole book that I'm thinking of actually writing is going to be, I don't know if it's going to be called 5 Things You Need to Do Before You Refer.
Okay.
So, I think that gives you something to do. It puts some of the power back in your hands instead of going, I can't do anything.
Right.
I have to refer, because I think there's only 80 or so veterinary behaviorists in the country. That's not enough. So you can't refer these.
Oh, gosh. I'm going to have to learn some stuff. All right.
Dude, that's even fewer than boarded zoo veterinarians.
There's only 80?
Yeah.
Man.
What the
I think so. And then when I say board certified, there's some in Canada, there's some in Australia, there's some that are dead, some that aren't practicing. So that's the total number of veterinarians who have gone through the board certification process. I don't know how many actually.
Well, it actually just makes me feel better that it's that difficult that there's only 80 of them. I don't feel so bad and I can't solve these problems. But don't wait, medicate. I'm going to be good to go with that one.
That's it. Don't wait, medicate. If you just stop there. If I got all, and the thing about that though is if you're going to medicate, use the right medication,
right?
Use the right dose. So again, I either get referrals that they haven't started on medication or they've started on medication at the wrong dose, either too low or way too high.
Way too high.
Because if you start way too high, then you've got a lot of side effects, and owners don't like that. So now you have a dog that's not eating, it's lethargic, and so the owner's upset. The veterinarian's like, well, that drug doesn't work. And it's like, so let's use the medication that works at the dose it's supposed to work for the time it's supposed to be given to work.
And there's data to back that up, right? Like veterinarians can
data.
Access data for that.
I make fun because I like to rhyme, so I like to say that don't wait, medicate. But really, let's remember, everybody, you're doing that simply, to stop the owner from making a really, a decision that you can't come back from, and then use that time to kind of refer or not refer, just kidding,
exactly,
to figure out what's going on and fix the problem in a much better sense, or refer.
Yeah.
But I think what's interesting is there's only like roughly 80 board certified veterinary behaviorists, right? Isn't this the number one reason that pets are surrendered is behavioral issues? I mean,
I believe so. It's up there. Yep.
This is an inverse relationship. I mean, that's crazy. That's
crazy.
Yeah.
It's crazy.
Yeah. And so what do you think, Dr. Curtis, about owners? Because, these days, especially the millennial pet owner, they want to be incredibly engaged. They want to feel like they're informed. They want to know what's going on. Is there anything wrong with owners reading up on stuff and being prepared when they come to the veterinarian?
Depends what they're reading.
Okay. Good. That's fair. That's fair. So they need to make sure it's a credible source.
A credible source. So I think an article was just published about what first year vet students know about behavior and their perception about behavior.
Yep.
And granted, it's that group of people, but so many of them get their information from either websites or lay magazines, that kind of thing. And there's a lot of misinformation, especially alpha theory or dominance theory when it comes to dogs. And, and there's some. So you're not going to alpha roll into submission a dog that has separation anxiety.
No.
So it's really important that we go beyond the totally debunked and what's the word? It's
not that simple.
It's not a credible source anymore. And it's still such in the forefront of entertainment that this whole, let's show the dog who's boss kind of thing, that it's really going to get in the way of getting to the end that everybody is looking for. Yeah,
and another place to get all their information is their first year vets. They're scared to death, right? They're out there. Their first veterinarian is probably going to be some owner who's been, I'm not disparaging any older vets, but they're from a different generation that maybe treats things a little bit differently. And so they're going to get a lot of information.
Yeah, and so that's what I say.
Right or wrong, but that's their main influence.
I would like because a lot of folks in the Candyverse, a lot of news hounds, they're not veterinarians. They're interested and informed pet owners. And so I am always pleased when a pet owner or an animal owner or an animal care professional has done some research. I don't even care if it's bad research. if they bring to me what they have discovered or what they are thinking, and then that's part of the discussion, so that they're not just going off on a tangent on their own, and we can arrive at the plan for their animal together. But at least they've become engaged in trying to address the problem. But you got to bring it to the veterinarian. I mean, you
got to bring it to the veterinarian because, again, I get calls from people that, well, I exercise my dog 8 hours a day, like I'm being the pack leader. Still got a problem. Well, yeah.
Yes, they're not like.
I concur. You have a problem.
That's not the treatment plan. You don't want to exhaustion so that you don't see the behavior problem.
Oh my goodness. That's sort of my childcare approach, though. Let's get them tired.
Let's get them, unconscious.
That's everyone's childcare approach. What are you talking about? Why do you think swimming pools were invented?
Hello. Right.
Oh my God.
Yeah, and but I do think it's interesting too, because separation anxiety is not an issue of training. That's not a
typically not, no.
Right. And so, I mean, I guess overall anxiety can be an issue of inappropriate training programs, right?
I mean, appropriate training, absolutely.
Yeah.
So shock collars, choke collars, prong collars, yeah.
Yeah, because they have a bad experience. It gets worse. They're anxious. Blah. It just right. Ratchets up, right? But you're not going to train your dog out of separation anxiety because he's freaked out. He's not doing it to get back at you.
Right. So these misconceptions of spite and trying to get back at you can be very harmful and really hinder progress. So again, not cruel, but owners need to understand that their dog is panicked.
Yeah.
And that is to be addressed as a panic disorder.
Yeah. Well, this has been incredible. So we have Pearls. Number one, cats get separation anxiety. Wow. I thought they just thought the staff went home for the night, but they get separation anxiety. And I'm going to out Dr. Terry here because we are friends. I'm going to out her. Dr. Curtis, do you mind sharing with the Candyverse what color of cat is your favorite?
Well, okay. I have to admit, I now have 3 orange cats. Wilma D.
That's funny.
Murray, Sid, and I do have this new white with black and other colors on her, and that's Blanche Marie. So I am branching out into leaving the orange cats. So.
There's 3 orange cats and 1 non-orange cat. Are you worried about creating behavior issues with the non-orange?
I am working on a behavior issue right now between Wilma D and Blanche Marie, and I'm trying the just getting in between them approach. And,
you know what? Wilma D and Blanche Marie sound like they were competing seniors for homecoming queen at Rydell High.
That's exactly what it is. So I'm trying to get them to hunt together. I'm trying to have them find what's common between them instead of what's different.
Oh, I love it.
I'm also medicating Wilma D. So
I mean,
don't
you're
wait,
sort of obligated, right? So.
So there she is, the behaviorist, taking her own advice. I love it. No, I laugh because I am very familiar with the cats and the social environment for the cats in Dr. Curtis's household, and it's freaking incredible. Cats are lucky to find themselves there with Dr. Curtis because they're all very happy. Even Wilma D will figure it out that Blanche Marie's okay because Blanche Marie is adorable.
She is adorable.
She is. So she'll figure it out. Jason, do you have any other burning questions? Because we had cats get separation anxiety. We had don't wait, medicate. And also that, there's different kinds of separation anxiety, right? That's like a big umbrella. And did we have another pearl in there? Jason, did you pull out another pearl?
No, I just got my normal question of when can I refer this? When should I? Not when can I? When should I refer this case?
When Dr. Curtis has an opening.
I have her cell phone number now.
And did I not answer that?
So.
Yes, she did. She did. She did answer that. I love it. So any other parting words that you think every animal lover should know about behavioral issues in general or separation anxiety specifically? Like guest choice. Any other thing we ought to know that you wish everyone knew?
I wish everybody knew. I think that my advice to general practitioners would be to pick a medication combination that you're comfortable with. Mm-hmm. So like fluoxetine and alprazolam, and give it within the right dosing parameters and more. I think by having cases that you've given medications to and you've seen the results that are good, you're going to be more comfortable using it more and more. And I think that's really important. And to answer the question of Jason, when to refer, I think we really hit the wall where the medications aren't working, where the owner's just not getting it as far as the behavior modification thing goes. I really think that general practitioners can do more than they think they can and realize that it's not as complicated as they think it is. Excellent.
That's beautiful.
That's probably an excellent statement. General practitioners can do more than they think they can. That's usually true, right? So,
yeah,
great. So good piece of advice.
Where can we find you? Can we follow you on socials? Do you have a website? Where do we find you, Dr. Curtis?
I am working on a website at the moment, and
so maybe when this episode drops, we'll put up a website where you can find Dr. Curtis if you're further interested. If we don't have that in the episode notes, then you reach out to us here at Vet Candy, Jen at myvetcandy.com or Jason at myvetcandy.com, and we'll see if we can rustle up some information for you from Dr. Curtis.
So you can find me that way.
This has been wonderful. Dr. Terry Curtis, thank you so much for joining us.
Well, thank you. This has been fun.
Yeah, we appreciate it. So signing off from the cottage on the farm, I'm Dr. Jen.
Signing off from the basement, I'm Dr. Jason.
And we hope to see you guys on the next episode of Vet Candy's podcast and other news.
Let's Talk Pets, every week on demand, only on PetLifeRadio.com.